How you doing, Claire? So I'm Martin, I'm one of the physios here at Balance, and today I'm just going to do a session with you on trigger point therapy. So what we'll do is we'll start with the calf muscles, we'll start with the soleus, and we could do a couple of demos through. I'll do some hands on and some hands off, and you can kind of give me some guidance as we go. The first movement is you're going to do 2 circles with your foot in either direction, nice and slow. And as you're doing this, you're breathing normally all the time.
Oh, it feels good.
Good. Okay, the next movement then is what you're going to do is you're going to do a very little small knee bend. You're going to keep the foot nice and relaxed. And on the way down, you're going to apply some pressure just underneath the roller. Okay? So the second movement we're going to do is we're going to do a very small knee bend. Okay, keep the foot nice and relaxed. And on the roll down, you push down and apply the pressure and breathing out as you're doing it. Very good. Up. Is that pressure okay?
It's good.
Good.
I can feel it. It's good because my calves are pretty tight at the moment. So.
Okay. This time I'm going to show you how you can put the pressure on. So you're going to cross this leg over this leg and slide your foot quite low down, just there. So you can feel now how much pressure you're putting through. From this again, you do 2 circles with your foot in either direction. Good. Keep your breathing going so you're not holding your breath. Good. Lovely. So the next move then, you're going to take your knee slightly towards your opposite shoulder. So that's the position of the knee bend, and then you're going to keep the foot relaxed and roll away. How's that feeling?
It feels uncomfortable, but I can definitely feel that it's getting deep into the muscle, which is what I like.
So it should feel like somebody's hand, like it's a deep tissue massage that somebody else is recreating. What's a really nice test we can do is if you stand with the foot that you haven't done up onto the block for me. Good. And then with the opposite knee, bring it above your hip height. So try and bring that knee above. Good. And then if you repeat that on the opposite leg, so the leg that we've just performed the manipulation on, and then have a try. So again, get that knee up. You find you're more balanced.
Much more. It's more like central.
More central. And that's the whole point. So you're kind of releasing the tension in the muscles, so your muscles can actually function in a better position.
Yeah.
So for you in your fencing and your movements, quite quick movements, you've got more of a spring to your foot.
Brilliant.
So now you were saying your quads get quite tight.
Yeah, definitely.
This will be a good one to do. So I'm going to instruct you how to use this. You're going to roll up your side to the centre, and at the very top, which is up here at your hip bone, you're going to slightly turn and you're going to come back down the outside. Okay? We're going to do it quite slowly. I'll instruct you all the way. So if you want to put that into the position first, then when you've done your 2 knee bends, the next thing you do is you take your knee slightly up and you're going to rotate your leg in and out. It's like a cross friction across the muscle. It should feel quite nice and a little bit tender, but it should feel quite nice. And then you do that twice and then you move off again. So you go 1 roll down and back for a half, and again 1 roll down, back for a half. Good. Repeat the 2 knee bends again for me. So it's 2 little knee bends. You only go as far as you're comfortable with. You should feel a nice stretch as you're doing that. Okay, and then you're going to do your 2 rotations. It's more just like that. It's like a rotation. Good. And off we go again. So 2 more rolls. Good. Keep your elbows tucked in as you do it.
I tend to use the trigger point performance tools after my training because I find, it is a form of self-massage, so it definitely helps my muscle, it helps release the tension, it helps speed up my recovery.